Hello, and welcome to the Alexandria Health Department's CHEMPACK training. I'm Dr. Ann Gaddy, Deputy Health Director at Alexandria Health Department, and I oversee our public health emergency management and epidemiology teams. During the 3 modules of this training, you will hear from 3 different speakers about CHEMPACK. What is a CHEMPACK? What is it used for? And how is it activated or deployed? This presentation was created as a team effort by Alexandria's emergency managers from Public Health, EMS, Office of Emergency Management, and Inova Hospital. You are here today as you have been identified as a critical employee that would support the efforts of identifying a crucial situation and treating our community during an emergency. We hope you find this training helpful for your work, and we sincerely thank you for all that you do. Please begin with Module 1.
Hello, my name is Jasmine Johnson, and this is a quick overview of the CHEMPACK. At the end of 3 modules, you will be able to describe CHEMPACK assets, describe types of nerve agents, recognize signs and symptoms of nerve agent exposure, explain the decontamination procedures, describe the management of chemical agent attack victims, provide an overview of the VA CHEMPACK plan, and demonstrate the steps of using a nerve agent antidote auto-injector. This seminar is designed to provide you with an overview of the CHEMPACK program, recognition of nerve agent exposures, and awareness of the state plan, in which we encourage you to return to your offices with this new knowledge and look at your current plans with your team. Module 1. After completing Module 1 of this seminar, you will be able to answer several important questions. The first of which is, what is a CHEMPACK program? How the CHEMPACK program is implemented here in the city of Alexandria, and the overview of the state and national CHEMPACK program. When are the assets needed? We are going to have a few pop questions along the way. So first question, what is a nerve agent incident? The accidental poisoning of 35 California farm workers with organophosphate pesticides in 1989. Yes or no? If you answered yes, the answer is correct. Next question. The 2001 anthrax attacks, where letters containing anthrax spores killed 5 people and infected numerous others. Is this a nerve agent? Yes or no? The answer is no. So the 2001 anthrax attacks, where letters containing anthrax spores killed 5 people and infected 17 others, was not a nerve agent incident. Anthrax is a bacteria, so it's classified as a biological agent, not a chemical nerve agent. In Virginia, CHEMPACK is only one of a number of programs that are part of the Strategic National Stockpile. The Strategic National Stockpile, or SNS, is a national repository of pharmaceuticals and medical supplies intended to supplement state and local assets in the event of a public health emergency severe enough to cause local supplies to run out. The SNS contains antibiotics, chemical antidotes, antitoxins, life support medications, IV administration supplies, airway maintenance supplies, and medical and surgical items. SNS resources are strategically located across the United States and prepackaged in push packs containing a broad spectrum of supplies that can be delivered within 12 hours of request to support response to nearly any kind of emergency. More specific resource needs can be supported by additional managed inventory. Here's another pop question. How long do you think it takes for a push pack to be delivered once requested? If you guessed A, SNS push packs can be sent anywhere in the United States within 12 hours, you are correct. Push packs are positioned in strategically located secure warehouses and can be sent anywhere within those 12 hours. Each state has plans to receive and distribute SNS medical supplies to local communities as quickly as possible. So, what are CHEMPACK assets? They are containers of antidotes meant to treat persons exposed to nerve agents. More specifically, a CHEMPACK is a big box constructed of wire Lexan mesh that is filled with smaller boxes of pharmaceuticals. The rationale behind the CHEMPACK program is that the prepositioning assets, antidote collections, or caches across the U.S. will serve to increase state and local capacity and thereby equip responders to rapidly treat large numbers of people exposed to a nerve agent incident. The CHEMPACK program mission is to provide, monitor, and maintain a nationwide program for the forward placement of nerve agent antidotes to provide state and local governments a sustainable resource and improve the capability to respond quickly to a nerve agent incident. Here's an example of what is in the EMS containers and what is in the hospital containers. We will pause here for a moment so you can look at this slide. So here's a look at the nerve agent antidotes that are in the CHEMPACK. You have atropine sulfate, pralidoxine, also known as 2-PAM, and diazepam. Other components that are in a CHEMPACK, you would have sterile water and Mark 1 nerve agent antidotes. So CHEMPACK assets are available for use in the event of a suspected accidental or intentional nerve agent release. Specifically, the ASPR recommends that CHEMPACK assets be deployed in the event of a nerve agent release that has a potential to overwhelm the local EMS and hospital supplies of nerve agent antidotes, puts multiple lives at risk, and threatens the medical security and public health of the community. It is expected that hospitals and emergency medical services will use their existing supplies of nerve agent antidotes, if available, before opening a CHEMPACK container, particularly if the incident involves less than 50 people. However, if responders anticipate quickly exhausting local supplies, they should not hesitate to request or open a CHEMPACK. At present, Virginia's 50 CHEMPACK containers are positioned at various locations throughout the Commonwealth. In the context of the CHEMPACK program, these institutions are referred to as host facilities. ASPR owns and manages all CHEMPACK's assets. Each facility that hosts a CHEMPACK container must comply with specific security and storage requirements. CHEMPACKs are equipped with special telephones called sensophones that automatically sends a message to the ASPR if the container is open, if the proper temperature is not maintained, or if security is breached in any way. Host facilities are in close contact with both the Virginia Department of Health and ASPR to implement the CHEMPACK program within their facility. At the discretion of the Virginia Department of Health and in consultation with the ASPR, CHEMPACKs may be temporarily transferred to a location closer to the site of a high-profile event, where the risk of nerve agent exposure may be increased due to the heightened visibility. Such occasions may include a major sporting event or a political convention. All CHEMPACKs are returned to their host hospital at the conclusion of the event. Here in Alexandria are where some of our CHEMPACKs are located. One is in at Station 209. The other is at Inova, Alexandria. In addition to those involved in management and oversight, there are a variety of agencies involved in the deployment and use of CHEMPACK assets in the event of a nerve agent incident, including local fire and emergency medical services, state and local law enforcement, emergency management, hospitals, and state and local public health. The following slides are intended to help illustrate the roles and responsibilities of these different groups and how all must work together to ensure an optimal response. The state and local police are often the first responders on the scene of an emergency. Therefore, it is imperative that the police are able to recognize a potential nerve agent release in order to report this to dispatch. State and local police may also be called upon to ensure the security of CHEMPACK assets at the scene of an emergency and to assist with security at the host hospital. Emergency management may provide coordination for incidents requiring or potentially requiring CHEMPACK resources. OEM can disseminate timely messages to the public using the wireless emergency alerts and across social media if needed. Then, if it's necessary, the EOC could be open. When fire and EMS arrive at the scene of an emergency, they are generally responsible for establishing incident command. Upon assessing the scene and determining that CHEMPACK assets are needed, they make this request by contacting CMED, which includes coordinates regional communication among emergency medical services and hospitals. Fire services is also responsible for overseeing decontamination of exposed persons on the scene. EMS may assist in transporting CHEMPACK assets from the host hospital to the incident scene. Upon arrival of CHEMPACK assets, paramedics are responsible for administering the antidotes to persons affected in the field. In the event of a nerve agent incident, many people will leave the scene prior to receiving treatment and will go directly to the nearest hospital. VDH, through the Regional Healthcare Coordination Center, will alert all area hospitals in the event of a potential nerve agent incident. However, patients may arrive before hospitals know to expect them. Therefore, it's very important that healthcare providers are aware of the possible signs and symptoms of nerve agent exposure. During a nerve agent incident, host hospitals plays a significant role in opening the CHEMPACK container and preparing to transfer assets to the scene of the emergency and to other nearby hospitals as directed by VDH and treat patients. This process is usually managed by the pharmacist at the host hospital. However, if the hospital does not have a 24-hour pharmacy service or if the pharmacist is unavailable, this responsibility may be assumed by someone in the emergency department, most often the nurse supervisor. The host hospital pharmacist will alert those involved of their roles according to the hospital's emergency plan. While not all hospitals serve as host agencies, CHEMPACK assets would likely be transferred from a host hospital to a non-host hospital if necessary in an emergency. Once CHEMPACK assets are available, clinical staff, including physicians, nurses, and paramedics, are able to administer the antidotes to patients presenting to the hospital following suspected exposure to a nerve agent. Nerve agent incidents may result from the intentional release of a chemical weapon. One of the most well-known examples occurred in Tokyo, Japan in 1995 when the cult Shinriko released sarin on the subway system. Another more recent example is the poisoning of Sergei and Yulia Skripal, a former Russian military officer and double agent for the UK's intelligence services, and his daughter Yulia Skripal were poisoned in Salisbury, England on March 4, 2018. More likely, a nerve agent incident may result from an agricultural accident or the mishandling of organophosphate pesticides, such as the West Texas fertilizer explosion in 2013. Either way, the ability to respond rapidly with antidotes for these nerve agents is essential to reduce deaths and injuries. All right, first question. Was it Fred? So it was correct. If you answered no, you are correct. While mustard gas is also a potentially dangerous chemical, it is classified as a blister agent, not a nerve agent. So the use of mustard gas as a chemical weapon during World War II was not a nerve agent incident. Next question. If you answered yes, you are correct. Sarin gas is a nerve agent. a chemical that attacks the central nervous system. 5 individuals placed liquid sarin in packages and boarded the subway system in Tokyo, Japan during morning rush hour on March 20th, 1995. EMS transported 688 patients. Hospitals saw 5,510 patients, 17 critical, 37 severe, and 984 moderately ill with vision problems. Most of those reporting to the hospital were the worried well. The attack killed 13 people. Salisbury, UK incident was that a nerve agent attack? If you answered yes, you are correct. We have discussed several real-life scenarios that have occurred in the world, so what is a nerve agent? Nerve agents are one of several categories of potentially harmful chemicals. While all nerve agents are chemicals, not all chemicals are nerve agents. Other types of harmful chemicals include blister agents like mustard gas and pulmonary agents like chlorine. Different chemicals affect the body in different ways, so people exposed to nerve agents require different medical treatment than people exposed to other types of chemicals. As you've learned, the CHEMPACK program is specifically intended to respond to nerve agent incidents. The antidotes in the CHEMPACK are only effective in reversing the effects of nerve agents. Many nerve agents are odorless and invisible and can be inhaled, swallowed, or absorbed through the skin. Nerve agents cause harm to human body by attacking the nervous system and disrupting messages sent from the brain to muscles and organs throughout the body. Without this input from the brain, muscles and organs stop working as they should, resulting in difficulty breathing, loss of control over bodily functions, convulsions, and death. Most nerve agents are originally produced in search of insecticides, but because of their toxicity, they were evaluated for military use. The good news is that antidotes exist that can reverse these effects. However, in order to work, the antidotes must be administered immediately. So when responding to a potential nerve agent incident, every minute counts. But nerve agent incidents are infrequent, and the antidotes can be expensive to keep on hand. So most local and hospital pharmacies don't stockpile large quantities of antidotes on their own. However, if there was a nerve agent incident, waiting 12 hours to receive antidotes in an SNS pushpack would be too late. Therefore, in 2003, the SNS was expanded to include the CHEMPACK program by pre-positioning containers of nerve agent antidotes in various hospitals throughout Virginia. They can be transported anywhere in the Commonwealth within 45 minutes. Moreover, many of the antidotes included in the CHEMPACK containers are specifically packaged into autoinjectors, which allow them to be rapidly administered. Nerve agents have been used in wars and by terrorists, known to be stored by several nations, including the United States. Manufactured compounds, G-type agents are clear, and VX is a clear amber color, odorless, oily liquid. Some nerve agents are classified as chemical weapons. They include sarin, tavin, soman, chlorophylls, and VX. These chemicals are extremely toxic substances, among the most lethal and rapidly acting of the known chemical warfare agents. Organophosphates pesticides consist of a group of approximately 40 closely related pesticides commonly used in agriculture practices to kill insects. There are also nerve agents, though far less potent than the nerve agent classified as chemical weapons. Fourth generation agents, also known as A series or Novichok nerve agents, are low volatility nerve agents, highly persistent, pose a significant cross contamination hazard, do not easily evaporate, unlikely to present vapor hazard, and are most likely to be encountered as a liquid. No illicit use or manufacture of a fourth generation agent or other nerve agent is known to have occurred in the United States, and there is no known threat of any nerve agent use in the United States. What you need to know about fourth generation agents is early recognition may be extremely challenging, with the possibility of delayed onset of symptoms for up to 3 days post exposure. The most likely route of exposure is skin contact, but fourth generation agents also can be absorbed into the body by mucous membrane contact, such as your eyes, nose, and mouth, inhalation, or ingestion. Fourth generation agents are highly potent, and contact with small amounts, even drops, can cause serious health effects. Responders should take measures to avoid any unprotected contact with the agent, suspected contaminated surfaces, or potentially contaminated people. Optimizing a response to a nerve agent incident is always understand the risk, early recognition, stop exposure, and treat the injured. Supportive care, antidotes, and forecast your needs. Plan for scarce resources, alternative solutions. In conclusion to Model 1, we need to make sure that we're saving lives in a chemical incident is key and possible. Time matters. Response to chemical incidents is local. Patient decontamination is a medical countermeasure. And in federal support, tools, guidance, best practices to optimize local response systems capabilities. You've reached the end of Module 1, Introduction to CHEMPACK. Hopefully, you now understand the purpose and rationale behind the CHEMPACK program and have an idea of how it has been implemented here in the city of Alexandria and in the Commonwealth of Virginia. You should be able to describe the types of situations where CHEMPACK assets may be needed and identify the different agencies involved in a response to a nerve agent. Now you will pause for a moment before you begin Module 2.